the pieces that you should have in your little kit here, you should have 2 Lido stents. You should have the introduction tube, the pusher rod, and the introduction tube.
Right. Which is which?
This is the pusher rod. With this is the pusher rod, and it has the little opening on the end that you're going to attach your. Do you see the little hole?
Right.
And that's where you're going to attach the stent, the little silver ball, in the end, just into that little hole.
I'm a little confused. Hold it back a little bit. This is getting a little blurry.
Yeah. So you just pop the silver thing in.
Right. So I'm just looking to see. I don't quite see what goes into the holes. Nothing, right? Nothing goes into the hole.
See this little part of your stent, the little round silver ball here.
Right.
We want, and then at the end of the pusher rod, there's holes in there. Do you see that?
Right. So the holes are there to indicate which side you put it on. But
exactly, and it's also going to secure it.
Install it in the end. That's it.
Yeah, and then it's going to secure it.
Great, I got it.
Okay. Oh, where did my, there it is. Then you're going to take the introduction tube, which is this piece here, and you can tell that this is a piece with the little black end.
Right.
And the idea is that you're going to now take your rod like this, your stent, and you're going to take the introduction tube this way, all the way down, so that it encloses and collapses the stent.
Right. That was kind of.
You want it to,
yeah.
Just so that it's just inside, and not poking out the end there.
Okay.
So sometimes, depending on the individual, sometimes we'll recommend for people, because we're going to do the insertion now. And so when you're doing the insertion, notice that there is a bend in the tube as well.
Right.
Right. So you want it to be going downward.
Right.
Not necessarily. Okay. So because we don't want to be going upward.
Yeah, okay. I got it.
Yeah. And so I'm just going to talk to you a little bit about what this is going to feel like when you put it in. Have you ever had your nose scoped?
Endoscopy, I've never, I can't recall ever having an endoscope put in my nose, no.
Okay. These are actually just a little bit smaller than the scopes that are used by the ENTs to do the scoping. So it's no more or less, uncomfortable than that. Also, we want you to know that it's going to be uncomfortable because you're inserting something into your nasal cavity, but it's not going to be painful. And it shouldn't be painful. And if you do find while you're inserting that you're feeling pain, stop, because that's going to tell you you're in the wrong place. You've hit something that maybe you need to have a look at, because actually that did happen once. We had one young guy that he's just 18 or 19, and he couldn't get past, and he was trying to, because you do have to finesse it. I mean, sometimes people have a deviated septum, and it takes time. You just, every day put it in a little deeper, wait, the next day a little deeper, but he had a solid, so he ended up going to his ENT, and sure enough he had a growth back there that he wasn't aware of. So it kind of let him know, which is good, because you do. So when you insert this, it's going to feel kind of foreign, and it's going to be a bit funny. So you want to insert this so that the silver ball is going to be sitting kind of right here, just kind of right at your nose, so you can pop it in there. And that's how deep you want it to go. So you don't want this bit to be like back in here in your nostril. You want it to be right at the tip so that you can just kind of pop it into your nasal fold there.
So hanging out from your nostril a little bit, so that
you can almost see it. You can just, so you can almost see it usually as you just kind of pop it up. The first thing that you're going to notice is, so we're going to be inserting this, and when we are inserting it, we actually had so much fun when I did it the first time, because I was like, oh my gosh. We were laughing till we cried.
No idea the anxiety I'm feeling right now. I'm trying to put a brave face on, but anyway, I'm with you. Okay.
What about it do you find the most kind of is making you the most anxious, do you think?
shoving something up my nose. I mean, I don't do that.
Yeah. And have you ever?
It's not complicated.
Yeah, I understand.
Yeah.
Have you ever had a bad experience that way, or it's just something that it's just the cringe factor of it all? And
It's the cringe factor, yeah.
Yeah.
It is what it is.
Yeah,
We're getting over it. That's what today's about. We're getting over that.
Absolutely. Okay. So the most kind of, for me, and everybody's different. Some people put these in and they're good to go. But for me, so when you insert it, first of all, I'll tell you first of all. So when you take this, we're going to be trying to aim towards the bottom of your earlobe. Okay. A lot of people, when they first, so you're going to be going kind of this way, just a slight angle, slight angle downward. A lot of people have this idea initially that they're going to put it in their nose, they're going to put it up because this is their nose. Your nose is up here and everything's up here, but it's not. So, and sometimes people run into trouble with that. So you're going to be inserting it this way, and we're just going to go kind of as far as the insertion insertion tube lets you, and then we're going to be retracting this back, okay, to let the stent expand.
I'm sorry, that last part, the insertion tube lets you. What does that mean? How far do you put it in?
Until just about, well, if you look in the insertion tube, you'll see the silver ball is just right here.
Right. Well, that's your guide. You want that silver ball to basically be at your nostril.
Right there. So when you insert this in, you're going towards, kind of on a slight angle downwards towards your lower earlobe. And then once that you get it into place and you can feel, okay, the metal thing is there and the end of the tube, you don't want it right at the end of the insertion tube because that's just a little bit far. And then we're going to be pulling this back to expand it and then take it all the way off. So that's when it expands against your turbinates. Okay. And that for me was the first time that I felt this is nothing. This was very simple. But when that first expands, because all of a sudden your turbinates are being pushed open and the pressure, and it's not painful, it's a little bit uncomfortable, and it feels a little tingly, kind of stingy a little bit, but nothing terribly dramatic. But that's when all of the extra mucus will come. You might want a tissue handy if you were like I was. And your eyes will tear up, and then you'll start to sneeze because this is your body just saying, oh my gosh, there's something in your nasal cavity, let me help you. It produces all this mucus to help lubricate, and you'll start sneezing just to help you dislodge this new thing, and your eyes will water a little bit. And then at that point we tell people, just wear it as long as you can. It will subside, it'll stop a little bit. If you can only wear it for 20 minutes, then just wear it for 20 minutes. If you can only do the one side, just do the one side. It's okay. It's okay. And then
there's two because you typically would be wearing it on both sides.
Yes, with the 2 in the 3-inch, you would be wearing it on both sides because you want to stent open both turbinates so that you have nice free passage that way. So, are you ready to try an insertion?
I'm ready to try an insertion. Let me just tell my daughter that I'm in a meeting.
Okay, no problem.
She's hung up, so. Okay. I'm ready to try an insertion. So. Okay,
so you're just going to put it at the base. Can you see me? You just put it at the base of your nostril here. You'll find your own little opening in there because everybody's got their opening wherever. And you just very slowly advance it and advance it. And you can tell by kind of feeling where the end of that tube is, kind of how far you've gone.
Wow.
And that's all we're going to do right now.
Yeah. Okay. Maybe I have to go see my ENT.
You may have to. Everyone is different. Is your nose dry? If your nose is dry, you can use some lubricant.
I went a little further this time.
And that's fine.
It's just coming right up against the wall. It feels like a wall, but it probably isn't.
Okay, it looks like you
kind of got... a little bit further this time.
Okay. Oh. I'm thinking that maybe, doctor, you have it downward a little bit. Maybe Because
I need to.
it seemed to me like you were kind of going like this to go in. You know, you need to be like here. You're aiming towards your earlobe.
Yeah, I'm trying to.
I know.
I'm reacting to my body responding to this.
Absolutely. And you know, like, some people will just...
It doesn't hurt, but it's like a little tingly feeling, like you say.
It's a little tingly. Your nose gets a little runny.
Yeah.
Talking makes it a little more tingly.
Sneezing.
Yep. Absolutely. You will feel like sneezing. Okay, so yeah, you're getting in a little bit.
Oh. It seems
Did you want to try the other nostril, maybe?
Yeah, maybe let's try that.
So again, you're starting down here like this. See, you're starting here like this. And
yes. Okay. Okay.
So you need
start more horizontal.
This pointing. So the tip of if you imagine the whole thing is pointing this way.
Right. Maybe that was the problem. Okay, it does seem to go further when I do that, but all of that is still...
Because I think you were getting into the middle meatus instead of the... Oh, you tried it. Yeah, sneeze. That's all normal.
Okay.
I don't usually sit on camera with a thing stuck in my nose, but here I am.
This is why I wanted to try the short one before the long one.
Okay, there you go, yeah. And you'll find it's like it hits a hard spot, but then if you kind of go laterally to the left or the right, you'll find a little opening. Bless you.
I feel like I'm a bad student.
Not at all. And some people can only put this in, you know, for the first few days, just do this. And that's fine too, it's not a race.
Oh, I'm sorry. Wow. Your body does...
Oh, yeah. Oh, yeah. I literally had mucus like a tap. Like I had to hold a tissue under my nose to keep it from...
Okay.
That's okay. How are you feeling right now?
The things I get myself into. You look fabulous. Yes. Donna's sitting there with her.
Oh, you know, I was the very same. Honestly, it took me a month and a half to even try it.
Oh wow, it's just like puckered up like this in there. I don't know if that's just in my head. Okay.
It could be definitely, because you have a lot of anxiety about it, you know. Are you pointing upward, or are you going along the base of the floor of your nasal cavity?
Trying to go along the base. I'm getting a little bit further each time, it seems. Oh wow.
That's no problem.
Wow. And it's not pain. It's not pain that I'm feeling. It's just this
the whole body is reacting and closing up, and mucus, and you know, all of that stuff for sure. It's no problem, Dr. Viviano. And the other thing, Viviano, sorry, it's right, Viviano. Did I say it right? I'm so terrible about these things.
Sorry, you call me John.
Viviano. Viviano.
There you go. Okay.
I also don't want you to hurt yourself by, you know, shoving this in and out of your nose, so. that's fine. We can try again tomorrow.
How about you go through the rest of the process and show me, because I have it on video here. You're certainly capturing this, so I can refer back to it, and I can practice this by myself, right? And then we can connect again. You know, once I'm able to actually put it in, right? You know, because I don't want to, tie you up repeatedly. I just,
honestly,
I want to be able to do this. Just to walk me through the steps. I'm looking at you, so I saw what you did. I understand more horizontal, going down out towards the ear. I did all of that. Yeah. It's just I'm taking it in there, and I'm getting a little further each time, but I'm, it's the sensation is just overwhelming. I can't.
Absolutely.
I feel like I'm up against a wall, and it's sure, like, I don't know if the body responds by easing up like that. I don't know. But it certainly is nothing like I've ever experienced before.
Well, I will tell you, Doctor, that you're not the first to have this experience. This is very common. And, a lot of people have never, and we've always been told, don't put things in your nose. So a lot of people have never inserted something into their nose. So when this is the very first, look at you. Okay, where's the end of your tube? It looks like it's in there to me. Yeah, you know what? If that's as far as you could go.
But it went in quite easily, right?
That's what I was saying.
I mean, all that resistance, and now it went in quite easily. I think my nose was listening. Okay, he's going to stop, and then the nose relaxed. I don't know.
Well, no, I mean, that is part of it, because you do have apprehension, so your whole body just kind of bracing itself for something. Good. There you go. Sometimes, and you know what, if for you, because you may have very sensitive mucosa tissue.
That last time, it went in pretty well.
You found the right spot. Right. Okay, so if this is all you can do, like if I had a patient and he was very anxious and he got it in, I might even say to them, you know what, just sit with this in your nose for 20 minutes today. And then tomorrow, come back and do it again.
Sure. But I'd like to take it off and do that part so that I know how to do that part.
When you pull back the tube,
right,
the introduction tube, it's going to expand. So you're going to feel pressure, tingly, little stingy, tingly like. So I found when first time I did it, that's when my eyes started watering and all the mucus came. And it's a little bit like, at first. So just so that you know. It's not painful. It's just like such a strange feeling that you've never experienced before. And I had to stop at first, and I did. I pulled it back a little bit, and then I just kind of stopped and waited until all the tears and everything stopped. But so then you're gonna, now that it's in there, and do you see that the silver ball is just there?
Yeah.
And you're about the same there. So what you're gonna?
Of course, I can tell. But
it might be a little bit even further. Oh, you're just at the tip. You're good. I think you're good.
Okay. Yeah.
Do you see the ball? Can you see the ball at the end?
I think so, yeah.
Okay. As long as you can see the ball there.
Reachable,
so now you've got that one tube with the black tip that's covering it and keeping it compressed. So now we're going to retract that back tube all the way down past and off of the introduction tube, of the pusher rod, sorry. So when you take it, you're going to, I usually do it now in one smooth motion, but if you find it very shocking at first, just take a little bit off and just kind of adjust a little bit and then pull it all through.
So show me the introductory way, not the way you seasoned do it. Like.
So here's the black, here's the tube, you just pull it off. You can even just pull it off a little bit there. It's starting to expand. The tulip part of it now is half expanded against my turbinates inside. Because I've got it, can you see here? I've just got it about halfway.
Yes, I guess.
It's hard to see because of the color of the tubing, but it's just about right there.
The angle was right.
So just pull that shaft back off, like over top of the white tube, to deploy the stent. You're leaving the white there, and you're pulling the one over top of it, the introduction tube.
You pull it wrong.
You see how it's slide? Remember, you're just sliding it off.
I'm a little bit confused here.
Okay. Do you remember this one that was on top of it?
Okay, the clear one's on top. So the one on the outside, the one on the outside is what I'm pulling off, right?
The one on the outside, which we call the introduction tube, because it's introducing the stent into the cavity.
I'm pulling it out, but I may have pulled it out a little bit. Did I pull it out a little bit?
Okay, I did too. No problem. I did the very same thing. I pulled the whole thing. Sorry, sir?
Yeah, I don't think I can slide it back in because then the tube would have expanded it.
Yeah, don't slide it back in. Never push it back in. So you just hold on to the white a little bit and start pulling this tube off until you can pull it all the way off.
So I think I pulled it out too far, right?
Yeah, you pulled the whole thing out with the stick, which is fine. That's no big deal. Just pull it all out now.
Pull it all out?
You can pull your whole stent out. And we can try again.
Okay, so, because this was staying in there. I was pulling on the wrong thing.
You're pulling the pusher rod and not the introduction tube.
Right.
Right.
Yeah,
so this is the pusher rod.
Okay, I got it. Okay.
But for the sake of your recording, you have 3 pieces that we're working with. You have the pusher rod, which is the little white rod that's bent, and it has the little opening, the hole.
Right.
That's the pusher rod. You have the introduction tube, which is the clear little tube with the black tip. And that's the tube that goes over top of the pusher rod.
Now, what I was supposed to be pulling out at the end there was that plastic clear tube that was on top. The pusher rod was all the way up, right? The pusher rod was all the way up. And I was pulling on that, so I was pulling it out slowly, rather than...
I did the very same thing.
Rather than pulling the exterior tube, which is...
Exactly. Yeah.
Okay.
And I did the very same thing the first time. So again, we take these. You're way ahead of me already. Then you put this over top. And we reintroduce it.
How do you like that?
You look at you, now you're in. And you know what? Can I tell you something?
It was easy. I'm just saying.
And for all of you're not even sneezing.
No.
Which is, and you're not, you don't have mucus, you're not. Yeah.
Okay.
So now you're going to take the top rod, which is the pusher.
I see. So I pulled on this thing down here.
Right, you do want to keep that static.
This plastic thing up here, clear one.
That's covering it and keeping it closed up. So when you pull that back, it will expand, allow it to open.
You actually have to press up on the white thing so it doesn't come down.
Yeah, I find you need to stable the pusher rod a little bit.
You need to stabilize the white, and then you can pull down the clear thing, because otherwise the white one will come down as well.
Exactly.
I can feel it expanding in there.
Yep. And it's a little funny, right?
Yeah, it certainly is.
Okay, there you go.
This whole thing is funny. Okay. Wow. I can't believe I did that. I can't believe I did that.
A little bit. You actually did really well.
We're related. I feel like we're related. This is a family thing, you know.
Seriously, how often do you sit and snotty? So now what we tell people to do to get this little piece, because sometimes people do have trouble with this. Because it's new, it's a little stiff. So it's hard to get it, like snap it off. So what you can do is you can pinch your nose here where the silver ball is. Take the pusher rod and bend it right towards your cheek to kind of snap it off the end. I actually have mine out too far. Pardon me.
Okay. So to pull, just to
I'll
press
do
it
it
like
again.
this to pull is not good. So go like this.
Kind of pinch it and then yeah, that's uncomfortable, right? Yeah, getting it off. So let me redo that. Pardon me, I'm just gonna blow my nose.
Yeah.
So here, I'm gonna put this in. There we are. Deploy. Pardon me.
Great.
See? I'm sneezing more than you are. And then you can pinch your nose, because the idea is that you want to pinch that end where the little silver ball is with that hole so that you can get it off. So there.
I got it.
It's from wiggling it around in your nose.
Yeah, I got it. Okay. I can see when you press this down, stabilizes it. So when you go like this, it just pulls off. Yeah, it pulls off. Okay, I got it. And so we can either walk around with the earring look.
Yeah.
Right? They should actually have
different ends. A little too far.
They should have different ends so that you could, like have a decorative jewelry, body jewelry.
You could get a little belly ring, maybe hang your keys off it.
Now, I don't know if I'm down too far.
No, that's actually perfect. That's fine. Next time if you find you want it to go a little deeper, it just depends on your own nose,
But it certainly feels weird when you push on it to get the ball.
Oh, no. Yeah, don't try to push it in at all.
No, I'm not trying to push it up,
against the grain.
Like you did, like push the ball up inside the nostril.
Yeah.
Right? Aren't you supposed to?
Yeah, usually. Well, it might be out just a little far because you should be able to just go just kind of flip it in there. Because if you look up, mine's there. Do you see it?
No.
No? Oh, okay.
It's gone. It's disappeared.
It's gone. It's way back there. Oh. So maybe next time you would just maybe pop it in
a little bit further.
Midget in a little further so you can just kind of pop it up there. Because you don't want to be pushing it back, because once the stent is inside of your nose, right? Once it's inside and this is the end sticking out, if it's inside and you push, it's going to do that.
Yes, no, I got it.
And it's also against the grain. There is a grain to this stent. This way is smooth. This way is like a cheese grater. So that's another reason not to do that.
Yeah. Okay, we
How does it feel?
Well, it feels like everything you described. Just a little tingly, like you got a foreign object in your nose and you want to blow your nose or something like that.
Mm-hmm.
So the thing that's most awkward, if you sort of like wiggle your nose or something like that, you feel it all scratching around in there. That's kind of weird. And actually sort of going anywhere near this. Here you go. You like my body jewelry? Yeah,
for sure.
I just shoved this thing up my nose for the sake of science. Has to be done right now. Earplugs.
Is it terribly? How was it compared to what you thought it might be?
No, the first few times that I went up and I couldn't get in.
Yeah.
That was probably because I was hitting something. Because it felt like either that or I was seized up. But then, the last time when I just kept wiggling a little bit to the right or the left, as you said, and as you said, sort of stayed horizontal and going back towards my ear. Once I found the path, it was actually quite straightforward.
Yeah.
It went in okay, and the sensations that you explained were what you feel. It's all minor, but it's there. It's
absolutely.
It's you want to sneeze or whatever. And even right now, as I'm speaking to you, I can feel it's starting to feel more normal. like just in a few minutes, I can. It's much like oral appliance therapy, and when you first put it in the patient's mouth and their jaw's a bit forward, and it's an awkward feeling. But even in the first few minutes of them sitting there with the appliance in their mouth and you're explaining things to them, it starts to normalize the feeling, and they don't feel so awkward, and they don't feel like they're in an awkward position with their jaw and so forth. So it's a similar type of experience, I think, here, where at first, it feels like really weird because this is not our norm. But within just a few minutes, it's starting to feel, right now as I'm speaking to you, it's starting to feel. And I can't imagine 15 minutes from now, probably profoundly better feeling, right? A normal feeling, right?
I think so too.
So forth. Yeah.
I think on my
this is all very encouraging because I was a little discouraged when I first started.
And I'll tell you too, even like when you go to do it again tomorrow, it's going to be even less. It'll be, oh, okay.
Yeah.
Because the first time I put them in, I actually had quite it expanded and suddenly my eyes just filled with water and literally mucus just dripping out my nose and sneezing. I thought, oh my gosh. And then I wore them for about an hour and I took them out. The next day I went to put them in. I thought, okay, brace yourself. I honestly, it was about 70% less of reaction and a review. Even just the next time that I did it. So you seem to habituate quite quickly to it. And you really do get to a point where a lot of us actually, if we're going out, like we just came back from conferences and the girls are at conferences right now again, we'll go out to dinner and have them in, because people have concern. Be like, oh, but
these three
are.
These three ones?
Yeah, because you can wear them for up to 18 hours a day.
Yeah.
And they last for up to 18 months. So you can eat and drink and go for a run or, whatever normal activity you might normally need to do.
Wow.
Are you producing a lot of extra mucus or no?
Well, there is definitely. I'm there's a little leakage going on, but it's pretty minor.
It's not bad.
Yeah. It's more like I can't go anywhere near it because it's the moment I touch it, you feel it all the way up.
When you get it in just that little smidgen, so it's not kind of exposed to being, rubbed and so on. And of course, it feels funny too when you kind of touch your nose, and it's because there's something there. Right. Yeah, but those things start to not really bother you. It just kind of feels like an earring or something. It just doesn't really. It's there, but it doesn't really mean anything.
Oh, this is the closest thing to a nose ring I've ever had on, and
we should put little diamond tips on them.
Yes.
Did you want to insert both of these guys?
No.
Okay.
But I do want to insert the long one.
Okay.
Yeah. I don't need this experience on the other side right now. I've done this. I feel confident that I can tell somebody what to expect and what this is about, and the fact that yes, there's going to be that initial but, because I've done it. I've done this now. I don't need to have the experience on both sides. But of course, the apprehension is much less now that I've done this, thinking about the other one. But of course, the other one goes right back to behind the soft palate. So I'm really curious to see what that feels like. Right. So let's get this critter out, so I don't cheese grate my nostrils.
Yeah. Okay. So I take a tissue because when it comes out, it's not going to be pretty.
Okay. It's not pretty now.
But look, you can't even see mine. See how you could wear this anywhere.
Yeah.
Nobody would know.
Yeah.
So you could just grab this. So some people will use this rod, and particularly with the 6-inch, some people put it back on and use it to pull out. It's not necessary at all. You just have to grab the silver ball.
Right.
And I would say slowly in one movement. Like it's nicer if you just go in one slow movement instead of jerking it.
I'll watch you first before I do that. Okay.
That's it.
Yeah. Okay. No big deal.
It is no big deal.
Yeah, no big deal. That was easy. It was actually a very gentle feeling coming out. I could feel it pressing up against the inside of my nasal cavity, but it was no big deal. So the hardest part was that initial sensation that you're feeling when you're going in there worried that, oh, there's resistance here, I'm going to damage something. That's probably the hardest part. But once you just sort of have the confidence that it's going to go, you just have to find the right angle and the right spot, and you just slowly go at it. And I got it in twice, right? Because I pulled it out the wrong way.
You did.
Well, and then again, I went in a second time, so I know I can get it in, no problem. And will be the same thing, so that's no problem. It's just a matter of whether I want the experience. So, no, I feel quite confident with this now, and and that it actually would subside those symptoms, right? That I was having, just because of how quickly it was resolving already, just in these few minutes that we were chatting, right? So I feel quite confident. I understand how you could all go out for dinner at a conference and all have yours and not be a big deal. And it's meant to be used during the day like that.
It absolutely is.
Sorts of athletic enhancement, and I get that. I'm looking forward to trying the 6.5 inch to see that experience back here, because I think predominantly for my patients, it would be the 6.5 inch that I would be prescribing. So that's why I think I need to try that one out. Believe me, the anxiety I had towards this shorter stint is completely gone.
Oh, that's fantastic. See, I'm glad you feel better.
And actually, at this point, I realize that, I'm sure we're going to be the same experience with the longer one. I just want to go through the process.
You're just going to feel that extra feeling in your throat so you get past, because when you put it in and you kind of get to that solid spot, and then you kind of go lateral left, you find because noses are like snowflakes. They're all just a little different. So you find your spot and you get it. And once it gets there, it's like, oh, okay, it's in. It's just you find the path and it's there. So you're just going to be going down past a little bit further, so you'll feel it in the back of your throat a little bit, but actually not that much further down than as you might imagine it to be.
So that's going to be the part that I'm curious about, is how to establish whether you're in the right spot back there. Because I know with that one you have to leave it outside, taped to your nose here. So that part's not an issue, but how do you know that you're... I was trying to visualize this ball in here, and I guess without a good mirror to look at.
You do need a mirror. And it's always good to have a mirror.
Yeah. So you're right. So if I had a mirror to look at, I would have been able to visualize the ball easier. There's no question. That one there is different though, because you have to gauge it based on where it ends up inside. So that's going to be interesting for me. As to how do you know that? Where is that?
Yeah, so I can tell you two things. First of all, and everyone goes through this the first time they put the 6 inch in. If you put it in too far and it stimulates your gag reflex, you've gone too far.
Right.
And so that's your indicator that that's too far for you, first of all. And the other thing is that when you open your mouth and you look in the back, you don't want to be able to see it at all. It needs to be up past that, just sitting up on that and stinting it open up above that. Hopefully I'll be getting mine within the next week. The next
step for this, just
cleaning.
Tap water?
Yeah, so the first thing that I do when I have mine, because you can see that it's kind of covered in this clear kind of mucus. So I usually take mine and I just put it under a warm tap water, rinse it all off, kind of brush off any of the obvious debris and so on. Then I take our spraying solution and I spray it all down and I let it just sit for a minute. Because I find if you don't do that, you think that you've cleaned it with the water, but you'll see, in the barb that there'll still be some even after it dries off. But a good idea too, this is our cleaning tube.
Okay.
And so what you do is just kind of push against it and let it pop over top. And because that'll keep the braid open, so that it gets into all the little crevices. Spray it all down, and then I let it sit for a minute. And then
after you rinse it.
I always rinse off. Yeah.
First.
That's what I do.
Then put it on the tube.
Yeah, because sometimes there's like obvious debris on there, so I just kind of give it a rinse.
So the rinse first, shake it off, put it on the tube, and then spray it.
spray it all, let it sit for a minute so it can
then
penetrate the
let it
mucus.
just air dry at that point.
Yeah, so you can eat, if you want to rinse it off after that, you can. I do, because I just always like to make sure that everything's gone, and and then you just let it air dry, and then you can just take it off and pop it back in your case.
Yes. Okay.
Yeah.
Fantastic. Okay. Well, listen, thank you very much. This was really, I think, went about as well as it could have. I look forward to trying out the 6.5 inch one.
I don't think the 6.5 is going to be as scary.
No, it won't be now for me. You know, this part here won't be a problem. It's going to be the knowing
where am I?
Yeah, that's going to be the curious part for me. You know, but
and then also kind of sleeping with it. I want to
is resolved for sure.
Yeah, that's great. I'm really glad that was helpful for you.
Yeah, well, your patience helped, so thank you.
Oh, I'm delighted. I love my job. I love doing this. I mean, who else can you play with noses and snot with than my patients?
There you go. That's great.
Yeah.
That's great.
Okay, well, you have a good day. I'll let you know as soon as I get my 6-inch, and we'll do this again.
Thank you. Enjoy your day.
You as well. Thanks so much. It was nice to meet you.
Nice to meet you. Bye-bye.
Take care.